Welcome to Advancing Healthcare Through Simulation, the show where we explore the cutting edge of healthcare, education, and innovation. I'm your host, Lisa George, and today's guest is someone whose work spans the worlds of simulation, biomedical engineering, health leadership, and accessibility. I'm thrilled to welcome Dr. Martin Ferguson-Pell, a professor in the Faculty of Rehabilitation Medicine at the University of Alberta in the College of Health Sciences. He has held academic appointments in Glasgow, New York, and London, UK, and he develops and applies advanced technology systems for the assessment of patients experiencing chronic conditions living in rural communities. He integrates markerless motion capture, robotics, and novel sensors to provide comprehensive clinic-to-clinic assessments for vestibular, mucoskeletal, and neurological conditions. A living lab comprising 15 rural sites has been created to evaluate, pilot, and spread and scale complex virtual assessments. They include an intergenerational pelvic floor exercise program, post-stroke spasticity assessment, real-time signal processing to enhance the audibility of teleconferencing-based assessments, and monitoring functional changes during chemotherapy. He has founded 2 startups, including Click and Push Accessibility, that reduces barriers faced by people with mobility limitations as they navigate public spaces, and Elixir Simulations, a nonprofit collaboration of 11 Alberta post-secondary institutions to advance virtual reality-based training where complex simulations and 3D constructs that represent particular challenges for learners. So welcome, Martin. I'm so pleased to have you on the podcast here with me today. I have so many questions for you. You've been involved in some really great projects and startups. So I'd like to start right away by getting into your background in simulation. You've been at the forefront of simulation-based innovation in rehabilitation medicine. What first drew you to the intersection of biomechanics and virtual reality in healthcare?
Thank you, Lisa, for the opportunity to come along and tell you a little bit about what we're doing. So this all really started because I had been doing a lot of work relating to people who use wheelchairs for mobility, and sometimes the injuries that can occur as a result of overuse. And so what we did was we built what we call an ergometer, which is a sort of set of rollers that a wheelchair can sit on top of. And then you push, and we can study and analyze and measure how someone propels a wheelchair. But the trouble with that was it's so totally boring in that you were sort of looking at a blank screen. And so we thought, wouldn't it be interesting if we could create a simulated environment around that? And so what we started to work on is the use of virtual reality to create simulated environments. And the way the rollers work is that when the speed of the rollers is different, then the virtual reality environment actually rotates. So you can actually navigate around a space by just typically propelling the wheelchair on the rollers. So that created this much more immersive environment for us to do those kinds of studies.
That is so interesting. I'm sure there were many iterations as you went through that process, and technology is continuing to improve in that area as well.
They did, because this was when we started to do this, which was around 2015. Virtual reality was still very much a sort of twinkle in people's eye, in that although it had been developed and used in the mid-90s, one of the problems was that the technology was really not up to it. And this resulted in people having nausea and dizziness and so on. And around about that time, when we started doing this work, a transformation occurred because of computing power. Right. And so the ability now to compute in small wearable systems like headsets created an environment where people were not experiencing those same problems, and they could get a much more realistic experience, a greater sort of peripheral vision sense in using the headsets, and also much less latency in them, which means that it didn't lag when you expected it to move, it actually moved. And that's one of the things the brain really can get upset with. And if it doesn't see things synchronizing properly, one of the things that can lead to that dizziness or nausea. So at that moment in time, we began working in that area, and the technology was beginning to blossom. The drawback with the technology then was that the way it worked was you needed to know where the person was in space. So we had these things we called lighthouses, which were sort of units on tripods that were placed at the corners of the space of measurement. And then those tripods or those lighthouses would then know where the person is. And that would all have to be connected to a reasonably powerful gaming computer. Mm-hmm. So that was the starting point. So you were still tethered, and that was quite restrictive. But then within 3 years, that changed. The tethers went away, and then the headsets that we're all familiar with now, which were essentially completely standalone, just wear them, and now you're immersed in the environment. That happened. And so we felt that we were right at the cutting edge in terms of where the technology was evolving, and our expertise was how would you use it in a meaningful way.
Mm-hmm. That is very interesting. Can you walk us through, maybe get into the different types of virtual reality systems your team are currently developing at the Rehabilitation Robotics Laboratory, and what makes them unique in the current healthcare education landscape?
Yes, so there are really a wide variety of different uses. So some of the ones that we're working on, but I would really like to sort of make sure we understand the true breadth of what can be done, because what we do is somewhat limited by how big we are and how much capacity we have to do work. And also, this is an area where you work in partnership, in that the academic environment like ours is really the place where the subject matter experts live. So these are the people that know about the field, but they may not know very much about how to do the development work for the software and the digital artwork that's needed to create the simulation. So this is a partnership that has to be created between the academic environment and what we might call a developer environment. So what we did when we got started was to build our own developer environment in our lab, so that we had a small group of people that were able to produce some proof of concept simulations of different things in rehabilitation. So one of the things that sort of sticks in my mind, because I think that many people who are in the clinical field will relate to this, is what is called the OSCE. And so the OSCE is essentially an exam that clinical students, in our case, physical therapists, occupational therapists, speech pathologists, but can also be in other areas as well, especially in medicine and in nursing and so on. It's a clinical exam where they have to go into a room, and then there are stations set up in the room, and there is a simulated or standardized patient at each of those stations. And the student has to go and take the history and interact with that patient, and then make some recommendations as to what should happen in terms of their treatment. Extremely stressful for students who are taking that exam. So what we did was to produce an OSCE that was a simulation of the real thing. And the idea behind that was that it would help students go through the experience in an immersive way, so they really felt that they were there, that you can use conversational AI, which means you can have a kind of chatbot-like discussion with an avatar instead of a real patient. And they could go through that simulation as many times as they wanted to build their confidence. So then when they go into the exam, it's already familiar and they've already practiced it. And they just, instead of being tested for their ability to manage the stress, they were actually being tested to see how well they were actually performing these history-taking, clinical profiling and advice kinds of interactions with a real standardized patient. So that was an example of what we did. And this has been picked up, and there are a number of other examples of OSCE-like experiences. But the point being that what VR enables us to do is to give people that opportunity to study at their own pace, to do it as many times as they want to do. We can save huge amounts of money, because if you can imagine how much a room full of standardized patients must cost, it gives people the opportunity to do this and then really succeed and be excellent at doing the task that we're asking them to do. We don't test people to fail them. We test people to make sure that they understand well enough to be able to go on and be safe in practice. So what we're really trying to do is to ensure that that knowledge and that experience and that skill set is embedded in the student before they go on to the next step. VR makes a huge difference in doing that. There's lots of evidence to show there's greater retention, faster understanding of whatever learning material there might be.
I really like that. So much more accessibility for the students to be practiced and scaling their experience, and probably more consistently as well, making sure that every student has that same experience as a part of those assessments. Would you say that what was the process like in building, I assume, the prompts for those type of assessments? Was it a little bit of kind of test and reiterate as you go, or does it seem to be at a place now where you feel like it can be very easy to implement for a wide variety of disciplines?
Yeah, so this is a really important part of how the whole business of developing extended reality applications is evolving. So in the beginning, what tended to happen was a developer who was excited about the idea, who might be working in their basement, would put something together, and they would probably Google the topic area and sort of build their own knowledge and then embed that within the application. And that was essentially the beginning. And partly that's because of, if you like, the coder culture, if you like, where, in order to write code, you have to be highly focused, narrow down your distractions, and really work on creating the code so that it works effectively. That doesn't necessarily build that skill set that's needed in order for people to interact socially, in order to gather the information and understand it, interpret it, and build it into the application. So I was talking about the idea of having a subject matter expert as part of it. Well, this is a different kind of coder, because now we're talking about someone who is coding, but also someone who is interacting with that subject matter expert. Different skill set. And so one of the things that was necessary as we sort of started to build this was to build that culture of interaction between the, let's say, academic expert and the person who is building the actual application. Now, the tricky thing about building XR is that it's very expensive to build a beautiful finished product. And we want to build more and more the actual end user into the design process as well. So spending $100,000 building the simulation and then putting it in front of a person who may be the end user of it and having them say, this is no good, it doesn't work, you're misrepresenting me, or it's inaccurate, is not a great situation. So what's evolving is, how do we build these XR applications in such a way that we can do it in an iterative fashion, or in a process of gradual development of different stages of the application, so that we get that feedback of users as we go along. We're still working on that, because building the code conventionally, it's either an all or none situation. Either the code runs or the code doesn't run. Mm-hmm. And what we really want is something in the middle that produces a proof of concept. So what's exciting about this field now is we're beginning to see the concept of no-code, low-code ways of developing these applications. So that instead of having to write raw code, what you're doing is working with modules of code. And of course, what we don't really know yet is how dramatically AI tools like large language models will actually change this as well. So maybe you can say to ChatGPT, create me this scenario, I need the code to do it. And at least in the first instance, that's not so far in the distance, where we would be able to get that preliminary code built from an AI-based system, which will reduce the cost dramatically and improve our ability to be able to do that iterative design, where the user could be much more involved in evaluating the different stages.
Yeah, I think there's still so much expansion waiting at our fingertips, but it's really interesting to hear kind of what your team has been able to do so far, and the great product that's come from it. So thank you for sharing that.
Sure.
Maybe we'll jump over to chatting more about how you were instrumental in establishing the Elixir Simulations, which focuses on transforming healthcare education through AR/VR. And what was the inspiration behind Elixir, and how is it pushing the boundaries of how we train clinicians?
Yeah, it's kind of an interesting back of the beer mat story, in that one of my colleagues and I went to visit a company in California who are one of the world leading companies developing XR applications and tools that are used for XR development. And we were there representing, if you like, the post-secondary environment and looking to the possibility of a fairly significant contract with them in order to bring those assets into the post-secondary environment so that post-secondaries in Alberta would be able to start to use a XR. And what we discovered was that the approach that they had was, well, you know, we got the product, and why don't we just deliver it to your central administration and then you can figure out how to implement it. And so what they were really doing was downloading the implementation process on the post-secondary institution. It's not the way post-secondary institutions work. They're much more granular than that. So individual instructors will decide whether or not they want to implement XR within their course, for example. And the procurement, the paying for these licenses for them to be used is something that would be made at a department level, a faculty level, maybe a college level. But there are many structures within the academic environment that would be involved in that decision-making process. So we felt that this company, although they were a world leader, were really quite naive in understanding how the implementation process would work. Mm-hmm. We realized that's where the gap was. And so we were sitting there in a fish restaurant in Los Angeles and figuring out, what do we do about this? And we said, we know what we need. We need an organization that is a collaboration across multiple post-secondaries, initially in Alberta. Mm-hmm. And what we would do is act as the bridge between the companies or the developers who have the interest in producing product and wanting to see it being implemented in the post-secondary environment, and trying to create that receptive environment in the post-secondary setting where this would start to be used. And this is a new technology. It wasn't going to just take off on its own. It really needed to be nurtured. So that's where we came up with the concept of Elixir, because we said we can now create a non-profit organization that represents the interests of post-secondaries right across Alberta. And what we can do is create this virtuous circle. So the virtuous circle would be what I was describing before, which is the subject matter expert, which you'll find millions of in post-secondary environments. They're full of subject matter experts. Mm. Developers, which is a growing industry in Alberta, so an opportunity for economic growth in a new area of technology. And pairing them up so that that the two would then produce good quality product, but then finish the circle, because once you've got that product, once you've ensured that it's going to be successful in terms of what you're trying to teach, then what you need to do is to get it into the marketplace. Well, where is the marketplace? Post-secondary environment. And so the other embarrassing thing that post-secondaries are still facing right now is that high schoolers are using XR in their classes in the high school environment. And they come up to the university or the college and they are expecting to see XR in the classroom, and it's not there. And so we have to break through that kind of almost conservatism about using technology in the classroom, or the flipped classroom, which is where some things are taught in the classroom and then they're assigned to the student to learn at home, where they could be learning at home using XR, using their own headset. So of course the initial barriers were, well, you know, people can't afford headsets and so on. Well, the cost of headsets has come down dramatically in that time period. And also libraries have them. So in Edmonton, for example, Edmonton Public Library has headsets. University libraries have headsets. So the barriers are coming down in terms of equitable access to the technology. So Elixir's job really, as we see it, is to help to promote this new technology and help it to get implemented and get embedded within the post-secondary environment so that we stay ahead of the curve.
And how many partners do you have at this time? I'm sure there's still more opportunity.
Yeah, so we have 11 post-secondaries that are currently associated with Elixir. Some of them are formal members, some of them are associate members of Elixir, and that really is quite a significant post-secondary collaboration. It's about 50% of the post-secondary institutions in Alberta, and we would like to see that grow.
Absolutely. You described my experience as an educator, wanting to see what technology there is, but not sure how to bridge that gap. So it's great to hear that there are these opportunities to connect those in post-secondary.
There are two things that we've also added into the picture that I think are quite important. One of them is our protege program, which is an opportunity for work-integrated learning for students who are thinking about a career in the development of XR, who I talked to earlier on about this idea that they're not just coders, but they're also people who have to have really good EQ, which is good emotional intelligence as well, because they're working across interdisciplinary boundaries. So what we're doing is, through the protege program, we're helping to build those skills in a deliberate way through work experiences that Elixir offers in collaboration with developers across the province. So we can't just sort of dump people into a job and expect them to thrive when it's as new as this. We really need to prepare people for success so that when they make that transition from the post-secondary setting into the work environment, and especially when those companies are relatively small and fragile, they can't afford to have people that are not prepped and ready to go. So what we're doing with the protege program is making sure they are ready to go. The second part is the reliability of the XR simulation that might have been developed for a learning experience. We can't afford to have XR experiences that are wrong. And so one of the things that Elixir is working towards is creating what we're calling the Elixir seal. And the idea behind that is that if the application that has been developed is supported by Elixir through our peer review process, then what we will do is have an independent subject matter expert, or maybe a couple of them, look at the application and then make sure that the information being provided is accurate. And then that way we can then put the Elixir seal on it, and then people can trust the content. That can only be done by an independent organization. So that's the purpose behind Elixir being that cross-cutting, non-profit, independent, trusted organization that's going to look after, for the whole province, the quality of learning experiences.
Sounds like a very well thought out process that it's continuing to build momentum in the province. So well done.
Yeah, thank you.
So moving over to your former role as CEO in the Alberta Bone and Joint Health Institute, where you oversee data-informed strategies for system improvement. How do you strike a balance between innovation and evidence in healthcare transformation?
Yes, well, this is very difficult because the first thing that is difficult in any healthcare system is being able to get access to data that enables you to create the evidence that you need. And so when the Alberta Bone and Joint Health Institute was established back in 2005, special relationships were built with orthopedic surgeons across the province who agreed to provide us with their data. So we knew directly from them what their experiences were and what their results were in terms of their patients. And that was really important for them because they wanted to work with an independent, trusted organization that would represent their data fairly and without any biases built into the results that were produced. And that was a founding principle of establishing the Alberta Bone and Joint Health Institute. And then we needed to build, once we had that access to data, and obviously build in all the necessary confidentialities that are needed and get the approvals from the government and so on to be able to be custodians of that data. Then the next stage was then to build the analytic capability. And so when we're talking about bone and joint health, it's really a very high volume area of medicine. And so we needed to build infrastructure and data capability and personnel to be able to manage that. That was put in place, and was given support by the government in the early days of creating the organization. Subsequently, within Alberta Health Services, as it was then called, we created what were called strategic clinical networks. And the idea behind the strategic clinical networks was that they helped to build the strategy for the province in terms of dealing with different areas of healthcare, one of which is bone and joint health. And so this was more than just looking at numbers and reporting on numbers, but it was responding to numbers. So as we saw, a wait list in a particular area or a particular issue that was arising at a particular point within the province, then it enabled us to then think about how we could build a strategy around that to resolve the problem, whether that's a staffing problem, whether it's a cultural problem, or whether it's simply difficulties in getting access to beds because of shortages of personnel elsewhere, like anaesthetists, for instance, and so on. So it's understanding the granularity of what makes that service in the health system work as well as possible. So we could provide the data that would indicate where the challenges were, where the successes were. And an example of that was some work we did on blood loss associated with orthopedic surgery. Where what we found was there was significant difference across the province in different hospitals with different practitioners as to how much blood loss there would be, and in terms of measured as the number of blood transfusions that would be performed associated with a particular surgery. So why would that vary? And it really varied because of differences in practice. And what we were able to do after pointing out to groups that were the higher users of blood in their procedures, that this could be something that they could reduce. And we saw a dramatic reduction in the need to use blood associated with certain surgeries. So it gives you an idea of the level of depth within the system that we would go in order to bring about improvements. And those improvements are both financial, because blood is a very expensive commodity, but secondly, there is an element of risk associated with blood transfusion. So from a patient standpoint, by reducing the need for blood, you are also reducing the risk of the surgery for the patient. So these are the sorts of outcomes that the Alberta Bone and Joint Health Institute was creating. And I think the final point about the way it works is that even when you identify a particular topic through the strategic clinical network that you want to focus on, implementation is not an edict where you say, thou shalt do this, and then everybody lines up and does it. This is a one-on-one, institution by institution, surgeon by surgeon conversation that needs to be held in order to build trust and to create the priority to deal with that change that we're trying to bring about in the way the system is delivered. And that's what ABJHI does, and that is go out and actually work on that quality improvement process by interacting with the people that are involved in delivering the service and winning over their trust and winning over their buy-in to bring about the change. It's a slow, ponderous process, but no matter what health system you're talking about, it's understandable that it needs to be done gradually and cautiously and with complete trust and confidence. And that's really what ABJHI's job is to build trust and confidence about how we bring about change so it results in better outcomes for patients.
Wow, but what an impact that must make. I really love the patient-centered approach, and I feel like we could talk about this for hours, but I'm really seeing a key piece that is interwoven between all of the roles that you have is collaboration with all of these partners and how important that relationship aspect is in the work that you do. So
absolutely is critical, and it's not necessarily a skill or an attribute that I felt I was born with, in that, I would say that especially my generation, sort of boomer generation, is to some degree naturally competitive in terms of the way they go about things. And that's kind of was instilled, if you like, in our upbringing. And recent generations, I think, are much more collaborative and build networks, and things like social media have been means to be able to do that effectively. And so I think boomers have had to learn about that, and they've had to see the value of it. And I would say from my own experience, this is a lesson that probably in the last 15 years I've learned, the incredible value of collaboration and building those networks and building networks that are diverse in many different ways, but diverse in terms of content and perspectives, diverse in terms of our classical ways of identifying people, and diverse in terms of their objectives at the end of the day. We're not all pointing in the same direction. Mm-hmm. And so understanding that and then coming to consensus on a way of prioritizing moving forward is also part of a collaborative process. And so I've learned that lesson, and I've found it's worked really well for me, and would recommend others, if you're not feeling collaborative, give it another thought.
Absolutely. Well, thank you so much for joining me today, Martin. It's been wonderful hearing about the impactful work that you're doing in many different fronts. Your leadership, your innovation continue to shape not only the future of healthcare education, but also how we think about systems, equity, and access in this rapidly changing world. So I thank you very much for being here today.
Thank you, Lisa, very much for the opportunity. I can't tell you how grateful I am for the privilege of being able to work in these areas. It's very, very satisfying, and it's a absolute pleasure to be able to continue to work in these areas. So thanks for the opportunity to tell you the story.
Absolutely. Okay, and to our listeners, stay curious, stay collaborative, and keep pushing the boundaries of what's possible in health innovation, and follow Advancing Healthcare Through Simulation for more episodes to come.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.